A seizure is a symptom of many different disorders that can affect the brain, not a disease in itself. In centuries past, the word seizure referred to people being taken over by supernatural forces.
Today we understand that a seizure is not a supernatural entity. It is simply a medical condition in which too many brain cells become excited at the same time. The brain is an electrochemical machine. Nerve cells, or neurons, use chemical reactions to generate electricity like a very complex battery. When a neuron becomes excited, it passes an electrical signal along its thin biological wire called an axon to communicate with other neurons in the brain. Those other neurons either can be excited or inhibited by the signal. When too many neurons become excited all at once, then a seizure can result. So a seizure is like an electrical storm in the brain. During this abnormal electrical storm, the involved parts of the brain cannot perform their normal tasks, and people experience sudden alterations in movements, sensations, awareness, or behavior. A seizure typically goes on for a few seconds to a few minutes. The end of a seizure is a transition back to the individual's normal state. Because the word ictus is Latin for seizure, this period of recovery is referred to as the post-ictal period, which can last from seconds to hours. A person's level of awareness gradually improves during the post-ictal period. Doctors often are asked what the difference is between a seizure and epilepsy. To the medical community, epilepsy is the condition of having spontaneously recurrent seizures. That means that one isolated seizure is not defined as epilepsy. There must be two or more seizures, or at least one seizure with a high chance of having another. To count as epilepsy, the seizures have to appear spontaneously without an immediate precipitating factor. For example, if Johnny falls off his motorcycle, hits his head, and has two seizures on the scene, it is not epilepsy because the seizures were immediately precipitated by head trauma. However, if he recovers, then starts having seizures weeks, months, or years later as a result of the traumatic brain injury, then that does count as epilepsy. The word epilepsy has a long history of social stigma, but epilepsy is nothing more than a brain disorder caused by uncontrolled, excessive, and synchronous electrical activity.
Seizure is a general term used to describe the medical condition in which too many brain cells become excited simultaneously.
There are so many kinds of seizures that neurologists are still updating how to classify them. Usually they classify seizures into two main types, partial seizures and primarily generalized seizures. The difference between these types is in how they begin. Primarily generalized seizures begin with a widespread electrical discharge that involves both sides of the brain at once. On the other hand, partial seizures begin with an electrical discharge in one limited area of the brain. All generalized seizures begin with synchronous electrical activity throughout the brain, accompanied by sudden generalized movements or loss of consciousness. However, there are still many different types of generalized seizures. A tonic-clonic seizure, once called a grand mal, is what most people think of when they hear the word seizure. When someone experiences a tonic-clonic seizure, first they stiffen and lose consciousness, which is the tonic phase. Then they begin jerking, and this lasts for several minutes, called the clonic phase. Sometimes seizures don't have a tonic stiffening and a clonic jerking sequence, but are just tonic seizures or clonic seizures. Other types of generalized seizures include absence seizures, when the sufferer disconnects from the world for a few seconds, and myoclonic seizures, which cause jerking, but just for a second or two. Partial seizures, which begin in a single part of the brain, are further described by two important additional criteria. The first is whether awareness, memory, and consciousness are preserved during the seizure. If they all are preserved, then a seizure is called simple partial. However, if any are impaired, then the seizure is called complex partial. The impact of a partial seizure depends on where in the brain it originates and how it spreads. Partial seizures sometimes have an aura, which is a warning that bigger seizures may follow. An aura usually occurs seconds to minutes before a seizure, but some patients can have periods of warning lasting a day or longer. There are many different ways in which people experience an aura. The start of a seizure in one of the temporal lobes can produce unusual feelings, abnormal sensations, or forced thinking. The onset of a complex partial seizure may be heralded by déjà vu, a familiar feeling, or jamais vu, an unfamiliar feeling. Some patients have auras of sounds, tastes, distorted vision, racing thoughts, or smells, like burning rubber. Physical sensations that can occur as auras include dizziness, headache, lightheadedness, and numbness. An upset stomach is a particularly common physical symptom. Auras can include a sense of tingling, rising up the body, or other strange feelings that are difficult to describe. Distorted emotions like fear or panic can also be a seizure warning. However, some complex partial seizures occur without any remembered warning.
Partial seizures, which involve an electrical discharge in a limited area of the brain, come in a variety of forms. Let's look at some common types.
A partial seizure begins with an electrical discharge in one limited area of the brain. How a partial seizure affects someone depends on whether it is a simple partial seizure or a complex partial seizure, and where in the brain it occurs. Different parts of the brain control different functions. The cortex or thinking part of the brain is divided into 4 lobes: frontal, temporal, parietal, and occipital. Other deeper brain structures relate to life support functions, movement, and other semi-automatic behaviors. At the back end of the frontal lobe is the motor strip, which signals muscles to move. A seizure in this part of brain will cause uncontrolled movements or twitching lasting for a few seconds to a few minutes. Towards the top of the motor strip are nerves controlling the leg muscles. Lower down are nerves controlling the trunk, then the arms, fingers, face, and mouth. If a seizure spreads along the motor strip, the twitching can march along the different parts of the body. Just behind the motor strip is the skin sensation area. A seizure here will cause tingling in the affected part of the body. However, tingling in the skin usually is not due to seizures. The back lobe of the brain is the occipital lobe. It contains brain cells responsible for vision. Seizures in the occipital lobe can produce flashing lights, shimmering lines, or visual hallucinations. The temporal lobe is the part of the brain most prone to develop seizures. It is responsible for many complex activities, including the formation and retrieval of memories and the control of emotional states. If a temporal lobe seizure spreads to both temporal regions, then the manifestation of the seizures increase, with a pause in ongoing activities, confusion, temporary memory loss, and fragmentary, automatic, robot-like behaviors. This type of seizure is called a complex partial seizure. It is the most common type of seizure in adults. In general, when awareness, memory, and consciousness are preserved during the seizure, then a seizure is called simple partial. However, if any are impaired, then the seizure is called complex partial. Someone experiencing a complex partial seizure lives in a moment-to-moment world. During this time, he or she may repeat the same phrase or action over and over in an automatic loop, not recognizing the repetition. This person also may fumble hands, smack the lips, or grab tightly onto things during the seizure. This automatic activity is called an automatism. Others just freeze in place and stare blankly with no automatisms and hardly any movement. After a complex partial seizure, people don't remember what was said or even what they did during a seizure. Some don't remember having a seizure at all. Later, the memory starts working again except for a gap during the seizure.
Generalized seizures, which involve a widespread electrical discharge across both sides of the brain, come in a variety of forms. Let's look at some common types.
Generalized seizures are characterized by synchronous electrical activity throughout the brain. But each type of generalized seizure has a different effect on people. Here's a typical story from the parent of someone who gets tonic-clonic seizures, which were once called grand mal seizures.
These seizures only last a minute or two, but it seems like forever. It begins with an unnatural shriek, then she falls, and every muscle seems to be activated. Her teeth clench. Shortly after she falls, her arms and upper body start jerking, while her legs remain stiff. Finally, it stops, and she falls fast asleep.
A tonic-clonic seizure is what most people think of when they hear the word seizure. Although these seizures are distressing to watch, the person having them is unaware. We don't believe that the seizures are painful, but people can injure themselves by biting their tongue or straining their muscles. The tonic or stiffening phase comes first. All the muscles stiffen. Air being forced past the vocal cords causes a cry or a groan. The person loses consciousness and falls down. The tongue or cheek may be bitten, so bloody saliva may emerge from the mouth. The person may turn blue in the face. After the tonic phase comes the clonic or jerking phase. The arms and usually the legs jerk rapidly and rhythmically, bending and relaxing. After a few minutes, the jerking slows and stops. Bladder or bowel control sometimes is lost as the body relaxes, leading to incontinence. Consciousness returns slowly, and the person may be drowsy, confused, agitated, or depressed. Sometimes seizures don't have a tonic stiffening and clonic jerking sequence, but are tonic only or clonic only. Absence seizures used to be called petit mal seizures. Here's a typical story. Frank, a young man, often blanks out for up to 20 seconds at a time. During a seizure, Frank doesn't seem to hear anyone. He blinks repetitively, and his eyes roll up a bit. During shorter seizures, he just stares. Then he continues, as if nothing happened. Some days Frank has over 50 of these spells. Absence seizures usually begin between ages 4 and 14. They can resemble episodes of daydreaming. If they go on for more than 30 seconds, or if there's a lot of movement, then the seizure is called an atypical absence, which is harder to treat. Here's a story from someone who gets myoclonic seizures.
Each morning, I get these jumps. My arms fly up for a second, and I often drop what I'm holding. Sometimes my mouth shuts for a split second. Once I've been up for a few hours, the jumps stop.
Myoclonic seizures usually last only a second or two. There can be just one jerk or a series of several. Consciousness may be lost, but seizures are usually so brief that it's hard to tell. Here's a typical story from someone whose husband has atonic seizures.
When Bob has a drop seizure, he falls to the ground and often hits his head and bruises himself. Even if I'm right next to him and prepared, I may not catch him.
The sudden loss of muscle tone during an atonic seizure can cause the head to drop suddenly, objects to fall from the hands, or the legs to lose strength. This type of seizure is also called an akinetic seizure or an epileptic drop attack.